maybe that's part of the reason why. And then anyway, yeah, whatever. If you come, you come. If you don't, you don't. And then you miss out. Anyway, so on Wednesday we worked a lot of upper body, focusing in on kind of creating that space, hydration for the upper back, shoulders, neck, and so on. Remember, every movement that your shoulder makes affects your heart and your lungs especially. And so moving your shoulders, your back, it really is intertwining to all the other structures of the body. So you're more than welcome to sit if you want to, because I'm going to just stand.
Talk for like 3 minutes.
Yeah. So, but you can sit on a chair, you can sit on the ground, whatever you want to do. But knowing and reminding yourself constantly, because it was probably constantly not reminded of you, your body is integrated. There is nothing you can do without the use of something else. And if you have a pain someplace, you have a pain someplace else. And it's just, that's where the pain is coming out. The flip side of that is, when you feel good, you actually feel good. Okay? So most times people, they know every time they're in pain, whether they stub their toe, whether they just have whether they have a headache, whether they're blah, blah, blah. But if you ask somebody if they feel good, like, well, kinda. It's like, well, do you or don't you? You're living in your own body, and you know if you're feeling good. If you're not feeling good, it's okay. Know that that's the problem. If you are feeling good, rejoice in that. Stop acting like you're a martyr all the time, and it's not a good idea to feel good. Turns out it feels good to feel good. And don't worry about it. If you're the best feeling person in the room, awesome. Everybody else can just suck it. I mean, seriously, just like forget it. Too bad for them that they don't feel good. And you know what? You can say, well, it turns out I feel good because you know why? Because I believe I feel good. Your mind makes more interactions into your body than you know. Every thought you think, every kind of interaction that you have is put into your mind. The body just reacts by what you think. It's not reacting by necessarily only reflexive, but it's reflexively interpreted into your head. So if you constantly think you feel bad, you'll feel bad. Okay? Stress, the body does not understand necessarily, the brain does not necessarily differentiate your thought experience and your actual experience. So if you constantly walk around, doesn't matter if you say it out loud to anybody else, if you say, I feel bad, I'm in pain, my life is stressful, I don't like this, I hate work, blah, 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 all these things, you're living in stress. Then when something bad happens, it's now escalated even higher because you've already started a base layer of everything's horrible or I'm in pain. It's like the horrible, no good, very bad day all your life. So give yourself the opportunity to acknowledge that sometimes you just feel good. And even if something hurts, turns out most of you probably feels good. And I posted, even if one hand hurts, for the most part, you're having a good day.
Absolutely.
If not, I'm sorry. Yeah. And then, so give yourself the opportunity to feel good, to acknowledge you feel good. I promise you, it changes your serotonin levels. It'll make you a little bit more tingly and kind of more energetic than if you feel bad, act bad, move bad, all of those types of things. It makes a huge difference. 100%. And if you get something that's an illness of some sort, and if you give yourself the opportunity to be optimistic about it, I know that seems hard to be optimistic when you're in pain or when you hurt or when something goes wrong for you, but realize that you don't live on an island. You actually live with other people, and you can be optimistic in your own world. It doesn't matter what anybody else thinks. Be optimistic, give yourself that opportunity. Just don't be terminally optimistic, meaning you have to give a shit about something. And so allow yourself to be optimistic, allow yourself to turn inside and go, you know what? This is working. The post I gave the other day really is about your strength, not your weakness. Remember, your body isn't working against you. Your body is constantly, every day fighting for you. And if you can connect into that primarily, you really have a strength that most people don't have. In this culture, in this climate, in this day, what we're dealing with right now, there's more depression than there was when the AIDS crisis started. There's more depression than there was when World War II happened. There's more depression, anxiety, stress than when there was when we had the Cuban Missile Crisis. So they're looking at overall problems and issues in depression, anxiety, and lack of motivation. And they're seeing that this situation is like extraordinarily worse. Interestingly enough, you have a 99% chance of surviving this. And you know what? I'll say this out loud, and I've said it before to some people. I was one time given a 50% chance of surviving something, and I did. So give yourself the opportunity to live optimistically. Give yourself the opportunity to do better at any one given day. So, all right, let's go ahead, and you can stay there and actually go ahead and stand up. Because standing up is good. Blood flow. As Lucy says, when we stand up, it goes straight down. It doesn't just go off, it doesn't have to go off through all the curves and that kind of thing. So if Dr. Lucy knows, I'm sure this all follows and goes through. So if you have your toothbrush, grab your toothbrush. There might be an extra toothbrush inside that bucket. If there's not, you can use your fingers and that kind of stuff. So again, come prepared or be prepared to use your toothbrush, your large soft and large firm balls and the other balls, as well as your roller and any other equipment that we're using. We're not using the stick today though. Okie doke. So go ahead and take that toothbrush and you're just gonna rub right across that collarbone, nice and light. Remember, skin contact is super important because remember, the brain comes to the surface at the skin. And then you're gonna take the toothbrush, turn it around. You're gonna do the same thing so it's a little firmer, about the same degree of tension. And then you're gonna take it and you're gonna tap. You can either tap with your toothbrush or you can tap with your hand. 2, 3, 4, 5. And then we're gonna pull down, like drag the skin almost down, down, and down. Let's do the right side. Remember, movement isn't just for movement's sake. Movement is for feeling's sake. And if we feel better, we will move better, we will live better, we will interact better. I mean, just think about when you feel like you have a cold. You kind of don't feel good, and it kind of interacts with your entire day. Backside, up and down. I keep getting this caught in my necklace. I'm like, makes for great video too, as I just try to struggle over here. And then tap 5 times. 1, 2, 3, 4, 5, and pull across. So you're gonna pull across the skin if you can, from your right to your left, from your right to your left. All right, behind the ear, right at that space, if you stuffed your finger up and behind the ear, a friend of mine calls it the back ear hole. Go with the brush part and just kind of brush down like you're making a nice feather light down that sternocleidomastoid mastoid muscle. It goes all the way down and underneath the collarbone. The phrenic nerve and the vagus nerve all go down that. The vagus nerve connected into the parasympathetic. Turn the other side and pull down a little bit firmer. The phrenic nerve is more associated with the sympathetic nervous system. Tap 5 times. Kind of sounds like a watermelon. It's pretty ripe in there. And then pull down. Good. And then right side. And notice, I mean, you may notice gunkiness in there, maybe ticklish in there. That's all sensory perceptive. So turns out we aren't technically ticklish. Turns out we have sensory perception. And that ticklish is kind of this. For whatever reason, we laugh. I don't know why, but laughing and crying are work on the same pathway neurologically. And so laughter is essentially crying in a happier looking way. Because you've heard of people laughing probably backside, even when they're under stress. And you've probably heard of people crying when they're really happy. When they're really happy. Yeah. So you can't say someone's happy or sad when they're crying because, I mean, you can if it goes with the emotion, and then tap. But we tend to associate and we tend to put value on, oh, she cries so well. Well, what if she laughs really well? What if she enjoys herself and that kind of stuff? I don't say, again, you don't have to laugh at all your pain or anything else, but or somebody else's especially. So right there, right at that ear hole, so the front ear hole, if you put your finger there, you'd close off your ear, but don't do it in your ear. And then go a little firmer, a little faster, right around there. I'm just kind of going right in that little, kind of right up against that ear flap, you know? They all have technical terms, but does it matter?
Yeah.
And then tap 5 times. Again, a little hollow watermelon. And then this time you're gonna pull down and under and or up and around. So you can go either way, down and under and or up and around. If you have glasses, it's a little bit more difficult to go down and under. Other side, feather light. A little firmer, a little faster. Tap 5 times. And then pull up and around. 1, 2. Remember, you have lymph all the way back through here. Helps to drain that down. So I'm going to take my glasses off for this next one. It's because you're going to go on your left. So just so I don't get underneath my glasses or poke myself in my eye. I've done it before. Luckily, we have these like reflexive, like thing. We jerk away. It's good. It's good. Kind of teaches us not to do that again. Backside. Pull down towards that ear hole, because now we're draining. Remember, we're draining everything back to that left side. So we open the left side first. Now you're going to put your finger on your toothbrush, on the back side of your toothbrush here. Get as close to the eye hole as you can. Put it in there and go underneath the cheekbone to the ear. Underneath the cheekbone to the ear. And of course, you're being gentle and sensitive as best you can. Good. And then we're going to do the other side. And then the back side. And I probably could look forward, but it's like when you go into a parking structure and you duck. Because like if I move my eyes out of the way, I won't poke myself in the eye. And then tap 5 times. And then pull. Eyes look up and pull down. Oh, a little gunk in there. Good. And then above the forehead, like you're getting yourself a nice little eyebrow thingamajig. And then the other side. And then tap 5 times, be gentle. You're gonna bong yourself in the head. And then you can go down and around towards your ear, or you can come in and around if you can be careful. So you can go around towards your ear, or you can come in towards your ear, towards your eye and ear. Just want to be careful. Good, and then the other side. Remember, it's 5 about, nice and light. 5 firmer and faster. Firmer or faster. 5 taps. And then 3 pulls. So again, pull down. Remember, all of this is sinus too, and there's lymph all in there. So if you wake up with those big old freaking puffy eyes, you got lymph gunk going on in there. It's not draining in the night. If you wake up with gunk in the back of your throat, that's lymph probably, as opposed to also possibly something coming up from your gut. Good. So sphenoid bone, if I had my glasses on, is just above. So you can kind of feel the corner of your eye, so the bone in the corner of your eye. And then the sphenoid bone is just above that. So you've got right here, corner of your bone, and then just above that is sphenoid. So we want to put our finger right in there. You want to be careful with the sphenoid bone. You pack that sphenoid bone in, you can give yourself a headache really easily. The sphenoid bone is also known as the capstone. It touches all the other bones of the skull. And then tap 5 times again, gently. And then pull. This time you're going to go back. So I'm going to pull and I'm going to go back behind my head. Down like to the base of my occipital bone. And then the other side. Woo. Right there. And again, we go light because the body likes light touch first. And then we can go a little bit heavier and a little heavier so that the body doesn't get oversensitized. Remember, we're touching sensory nerves. Sensory nerves are very superficial nerves. But those sensory nerves connect into deeper nerves. And then tap 5 times. I really did my hair before. By the time I get done with this, I'm going to look like I have bedhead. And then back up and around, or I did something not smart before, something, woo, woo. One more time. All right. So I'm going to take this because I don't want to get it all caught in my hair. Going to go to the back side, underneath my occipital bone here. So back of the line of the neck, way back in here. So if the first bone you come to, kind of straight behind the ear, going on my left side first, underneath there. We're almost done with the upper body or the head. And this is a full, complete head kind of a series. So, very often we just do the whole body. We just kind of go quickly through it, the tribal 5, and then tap 5 times. And then pull down, pull down, pull down from the back. Last one here. Then we're going to do a quick rest of the body. And then a little firmer, a little faster. A lot of gunk gets caught in here as well. And then we're going to tap. And then we're going to pull down. You may even feel clickety-crackety in your neck when you do this. Good. From there, the axillary brachial nerve. Tap 5 times. And pull up to your left. And then on the right side, underneath. And then pat 5 times. And then pull across. And then sternum. And then firmer, you can kind of go up and down, side to side, up and down, side to side, up and down, side to side. And then tap 5 times. And then from the base of the sternum, pull up and to your left. Up and to your left. Up and to your left. Belly. Now, belly should be mushy. And even if you have ripped abs, it still should feel mushy. And so if you have hard spots or very tender spots, that's a lot of lymph backup. Remember, cisterna-chyli comes out of the liver, right about there. And then you've got across there, you've got your ascending colon and so on. So you've got a lot of colon movement right here. So you get bound up right here. And then it makes a twisty turn down. Whoosh, go down to the descending colon. Boop, then out the chute, ideally. Good. And then pat 5 times. And then pull up. And then inguinal. So inguinal joint from the outside of the hip bone down all the way to the floor of the pelvis. I kind of hinge just so I can get in there. Good. Tap 5 times and pull up. We've got 2 more spots. Inner thigh, big reset today. A little firmer, a little faster. Pat 5 times and pull up. And then back of the knee. Pat 5 times and pull up against the back side of the body. And then come up. We're going to do 1 more spot. So I want you to pinch above the elbow and just below the elbow. Above the elbow, just below the elbow. Give it a nice, good little gentle pinch. And then pat 5 times. And then pull up and towards the heart. Good. And then the other side. Pinch. And then pat 5 times, and then pull. There is a reason why women get more of the hanging down skin than men do. It's hormonal, it's lymphatic. Our hormones are all through here because, and reacted to our thyroid and from our breast tissue. Think of all this breast tissue. Remember, the breast tissue isn't boing right there. The breast tissue goes up and around and underneath. So, and that gets clogged. And so, and then we've got a lot of lymph, more so than men do. Plus, we have a lot more tighter spaces than men do in there. So things get bound. So you want to work this a little bit more? I mean, you want to get this a little bit less, whatever, hangy downy, work this. Now, if you got to the point where you're down here, kind of a thing, and it's those angel wing sleeves, we may not be able to do much about it. But if it's essentially in contact with your body and not contact from space, okay, then we're in the ballpark of being able to work with it. Okay, so it's not a miracle, guys. It's just, but it's conscientious movement of lymph and tissue. Okay? Even if it is down here and people are, it's like creating its own air current. Okay? You still can move all this stuff. All right. All right, go ahead and grab your roller. If you want to go on the wall, go on the wall. You'll have the roller vertical behind your back. And you'll lean back into the roller. If you want to go on the ground, go on the ground. And actually, you're going to lay on the wall first, and you're going to want a full-length roller. On the ground, you can use a performance roller. So we're going to do a rest assess real quick. So I just want you to have the wall ready. If you don't have a wall available to you, get a wall. They're great these days. There's like going like hotcakes, I hear at the stores. So people are just dying and getting in line for walls. So lean against the wall or lean against the ground or lay against the ground. I'm going to do it against the wall just because I'm here and it's better for the camera. So your feet can be out in front of you. Your hands just kind of by your side. Now, as you're doing this, especially against the wall, if you want to stand up a little bit more, you're more than welcome to, because you still want to notice kind of how you balance into the ground. Your arms won't touch the wall, that's fine, but as your whole body touches the wall, you're really feeling those three areas that stuck stress loves to live in your shoulders, in your rib wall, diaphragm, and in your pelvis. On the floor, of course, you're noticing the hamstrings, the heels, back and knees as well, a little bit more specifically. And of course, you're getting gravity on the floor that's pressing down into you a little bit, or pulling you down rather. So think of just kind of finding that balance. As you're laying there, nice long deep breaths. Notice if your shoulders feel pulled forward. Especially on the wall, if it feels difficult to keep your shoulders back. Notice if the shoulders feel pulled forward. Excuse me, even on the ground. Or if you feel like your shoulder blades are the main thing touching the ground. Or it's your head's touching, especially on the wall, but your upper back isn't touching. And then just notice your arms. If your arms are touching the ground, notice if they feel evenly weighted. If your arms are hanging in space by your sides, notice if they're evenly touching your sides, or if one side feels pulled, twisted, or turned out of position. Or just there's pain. Pain is an indicator. Pain is an assessment all on its own. Take a nice deep breath. Take your attention to your diaphragm, noticing your rib wall, noticing that rib space. Notice if you have a high back arch, especially if you're on the wall, you may feel like it's just your butt and your head touching. Maybe it's just your butt and your shoulders touching. On the ground, you may notice that it's a very high or domed back arch, that the arch goes below the belly button. Ideally, your back should be essentially flat down to your belly button with a small arch, navel to top of pelvis. So think of that small space between your navel and the top of your pelvis. And then your pelvis itself, notice if it feels like it's sitting into the ground. When you're on the wall, you won't feel the butt cheeks so much, but you can feel if your pelvis is overly tilted. You can feel if your pelvis feels hunched or tucked. And you may notice if all your weight feels like it's on one side or the other. On the ground, you may notice that your weight is evenly balanced in your butt cheeks, or all the weight feels like it's sitting in the center on your bones, and your hamstrings may or may not feel like they're on the ground. Ideally, your weight is balanced and even right to left sides. And then even taking your attention down into your feet, notice if your feet feel like they're holding the weight evenly. Whether it's turned out evenly, whether the weight in the heel is evenly balanced. Good, go ahead and slide your feet in as you notice things, and go ahead and get a roller. And if you're on the wall, you're putting the roller vertically up your back. If you're on the ground, you're bringing yourself up onto the roller. Now remember, on that roller, you're always starting with gentle rocking. And remember, especially on the wall, it's really easy to do this kind of shimmy back and forth thing where the roller moves on the back, which kind of feels good, but the roller is part of your body here. And you're tilting and tipping like you're in a cradle from side to side. Fingers can be on the wall. Let your left shoulder drop in, let your right shoulder drop in. Good, go ahead and place your thumbs at your belly and begin to tuck your pelvis. And then tilt your pelvis back to level on the roller. As you're doing this, make sure you're not letting your rib cage lift and you're not clenching into your glutes to assist you. You're letting the muscles and the belly pull and tuck, finding that imprinting of the spine. Does that make your head, especially on the wall, pop forward? See if you can change your position so you can let the head be weighted back. And then taking your right hand to your chest, breathe to your rib wall in between. Nice big deep breath. Remember that parasympathetic turns on when you breathe into that diaphragm. When you just breathe into your chest or your belly and you bypass the real billowing to the width, you stay in your sympathetic nervous system a ton longer. And that can decrease your adrenal ability, so you get adrenal fatigue, thyroid ability, your ability for your heart to rest, and then your ability to actually move lymph more effectively because your body's under stress. From here, reach your arms straight out towards those knees, kind of at a slight angle, palms facing each other, and then let your shoulders pull back to kind of grab the roller. Reach forward and pull back. Reach forward and pull back. One more time, reach forward. Take your right arm overhead till you lose it in your eye line, and then take your left arm overhead, right arm lowers down. You're kind of passing the arms about midline, nice and slow. Keep your head back. Breathing. So we're working the shoulder girdle, which isn't the top of the shoulder. The shoulder girdle is actually underneath the shoulder and behind the shoulder. So if you feel any pull tension in your neck, you're trying too hard, and I want you to relax a little bit. I want you to let the flow of the arms move from underneath, not from on top. And if you need to do less, do less. It's okay to do less. Remember, less isn't less because you're lazy. Less is less because you're intuitive. Breathing. Unless you're being lazy. Bring your fingertips together and then pull those fingertips away from each other, expanding your arms, getting wide. Now, what you're doing is not stretching. It seems like it's stretching because you're feeling this, what in a sense in your vernacular you would find stretching. But it's actually what's known as tensional pull. Because notice we're not going to the ground and pulling and squeezing and tightening one muscle to release another. You're just allowing the gravity to take the arms away, and then pausing when you feel a pulling. Maybe that goes from your thumb all the way to the back of your ear. Your arms should feel supported without feeling like they're hanging there or without feeling like they're overly weighted. 2 more. Pull out. And back in. 1 more time. Pull those arms away from each other. Just let them open out. And then bend the wrist. One hand curls in as the other wrist curls back. So it's like you have, do gentle, don't get into pain, Marina. Okay. So do less or don't do. So just allow the weight. Yep. So if there's pain, you're moving too fast or too much because you're not being sensitive to where the pain is. Does that make sense? That's a yes or no question, Marina.
Yes.
Okay. Good, and then just go ahead and pause. Imagine you have weight in your hands, and then lower your arms down. Good, and then extend one leg or walk one leg back and roll off of your roller. We will redo or reassess again, leaning back into the ground or leaning back into the wall.
Wow, what a difference.
And just finding balance against the wall. Ideally, that head should just drop straight back. Even on the wall, it feels like it's just not resisting the wall again. You see that, Marina, too?
Yeah, oh, absolutely.
And then your shoulders settle back, your hips, and
Yes.
It doesn't feel like it takes so much work just to stand here.
Yep.
On the ground, you should feel evenly weighted at the back of the nose, The shoulders should feel relatively evenly weighted even into the hands. Ideally, the rib cage feels settled with no high back arch. And then the pelvis, the weight should feel more on its butt cheeks than into the bone at the center. Good. Go ahead and bend your knees, slide your weight in. Again, if you want to be on the ground, you're on the ground, or you can take that roller. We're going to go perpendicular on the roller. So again, I'm going to do this on the wall just because it's easier for the camera for right now. So again, this can be done on the wall, this can be done on the ground. So I'll cue it for both. So you want to have your shoulders, so when you roll the shoulders up, back, and around, knees are bent. If you're on the ground, shoulders are up, back, and around. Bend your knees. There you go. That way you're not putting any strain to extend and tighten through the knees. Just elbows move. Shoulders move. No movement of the elbows. Just roll those shoulders up, back, and around. Again, think of shoulder girdle, not elbow girdle. Good. Pause. Good. And then just take your hands behind your head as long as that's comfortable. And then you're going to just shift over to one side. So you guys on the ground are going to shift into your left butt cheek, but your shoulders are still essentially on the roller. It's called half back. On the wall, you're bending and straightening. On the ground, you're just rolling up and down on that one side of that one shoulder. Then you're going to pause, extend your lower arm, and then you're going to do that one shoulder circle. Nothing else moves other than that shoulder. So if you've kind of noticed there's a kind of other movements going on, try to mitigate that, do a little less. Keep that head centered, pause, take your elbow up as best you can, take your elbow down. On the ground, it's a little easier to get under the roller. One more time, and then back. Bring your hands back behind you, 2 inches up, 2 inches down. So your butt's coming just off the ground, head's back. And again, nice and gentle. Rotate to your right side. Got a little bit of wacky kind of roller here. And so you're on half back, and then you're still doing that side roll. So you're on the inside point of the shoulder. If that's too much for your arm, Marina, I'm not sure what arm you're on.
I'm on the right side.
Then you can take your hand down if you need to, if it's bothering your wrist or anything like that. Okay, good. And then pause, take your arm that's towards the roller off and roll the shoulder. Good, pause, bring your elbow up, bring your elbow under, bring your elbow up, bring your elbow under. One more time, up and under. Good. Roll back through the center. For the people on the roller, you're going to take the roller down to the lower part of your ribs. If you're on the roller, you're going to come up. So the roller's going to be at the very top of your shoulders. If you're on the ground, the roller's across the very top of your shoulders. If you can, place your hands behind your head. Lift your hips up if you're on the ground. Push your hips back if you're on the wall. And you're going to you're going to squat down if you're on the wall and push up into your back.
I can't get myself situated.
On the ground, the roller is against the upper back. So on the ground, the roller is as high as you can on the shoulders.
Okay.
Hips are as high as you can off the ground.
Got it.
And then you're going to push down the to the base of the rib cage. Up on the wall, though, you've got to push up. So you got to get down. So the roller, so you're down underneath the roller, and then you're going to push up. Down and push up with your legs. The roller will actually go down. Down and then push up. One more time. Down and push up. Good. Come off the roller. And then we're going to one more time reassess. Again, laying against the wall or the ground. So my hands are much more evenly weighted to my sides. I don't feel like they're kind of floating in space someplace. My head feels weighted. Shoulders are more evenly weighted. Rib cage more sunk into the wall. And my hips don't feel like they're heavy. My legs don't feel like they're heavy. On the ground, ideally again, weight behind the bridge of the nose. even weight from your sternum up to your shoulders, down into your hands, ideally. Ribs should feel level to the ground, not floating off. And pelvis, ideally, will be level or more working towards level. Being that we only work the upper body, the lower body is an indirect relationship. It doesn't mean it's not affected. It's just indirectly related to what we just did, upper body. Go ahead and come up. And then roll to one side. Go ahead and standing up if you can. And we're going to finish with a little bit of mobility. Maria and I were at 8:11, just so you know. But we have about 5 minutes left, so we're probably going to end at 8:16. Okay? Body's nice and tall. Chest is lifted. Shoulders are back. Just a big deep breath in. You can place your hands on your belly. Breathe into the ribs. And out. One more time. Breathe into the ribs. And out. Good. Let your arms drop. Look up. Look down. Close your mouth, sorry. And down. Gently look up. If you're noticing any tension as you look up, you've gone too far. So be aware. And what you can do is as you get close to that tension, take another breath. Breathe in and exhale before you come back down. And try to track that pain, that tensional pull where you get into that tension. And you'll probably get out of that tension a lot easier. Our breath is amazing at restoring movement. We just have to utilize it. The two things that restore movement are, one of them is going to sound funny, is breathing. Doesn't sound funny because I just said it. The other one is movement, restores movement. Turn your head to the right, turn your head to the left. If you just stop moving in an area, pain's never going to go away. It may move, oddly enough, but the pain will never go away. Good. And then bring your right hand to your left knee, left hand to your right knee. Look up with your eyes or with your head too. Look down. Look left. Look right. Look center. Good. Hands on your hips. Hinge back and come up. Hinge back and come up. Now slide the hands down your shins and come up. Down your shins and come up. So you're not moving the spine as much as you're moving the hips. 2 more. Bend your knees a little bit. 1 more. Stay down. Bring your hands to the tops of your knees. And then take your left hand. Reach your left hand past your right. Look over your left shoulder. Rotate and let your left hand come up. Look down and up towards your right shoulder. Reach across. Reach up. Notice I'm kind of moving my hips too. Look up and reach across. Look up and reach up. 1 more time. Look down, reach across, and then come back to center. Look up and reach up. Look down and look up to your shoulder and look up. Rotate and reach. Rotate and reach. 2 more times. Lift up, reach up, look down, and reach through. Bring your hands back, hands to your knees. Hinge back up. Right hand to left knee, left hand to right knee. 2, and the last one. Take your arms up. Take your arms down. Take your arms up. Take your arms down. 1 more time. Take your arms up and down. And we are done and done. Have a great day, guys. Go out that way, go out that way. And then I will see you guys on Wednesday. Let me know how you're doing. Let me know if you need help with any one of these techniques or practices, whether it's breathing or thinking or moving or doing, whatever it is. And also let me know on these things. So some of you said that sleep was a difficult thing, either to go to sleep or to get up from sleep. The big key is you want to manage your stress. And you want to recover as much as you can all throughout the day. So throughout the day, it's difficult unless you actually go quiet. So you literally need to shut down for, I would say, between 3 and 10 minutes, like a little baby nap. And you need to be able to give yourself diaphragmatic breathing. You need to release and or release the head lymph as well. So if you can do a lymph release midday, if you can do if you know how to do the umbrella release, which we're working on with next week, is or you know how to or just do that lymphatic release. So you want your body to move a little bit, you want to breathe a little bit, and give yourself that, just set a timer for 10 minutes and turn off all the music, turn off any radio signal there is, get outside in the sun, because I promise you, God designed the sun to be energy and to clean and restore. It is not just in the sun to give, it's not in the sky just to give us light. It is, but it actually will restore you. It actually helps your skin and revitalizes your skin. It literally does make a difference chemistry-wise in your body. So give yourself the opportunity to sit in the sun, whether it's just your face, whether you strip out, whatever you want to do. It's your backyard. Make sure the trees are full, okay? And give yourself the opportunity to have those moments in time. No drinking. You can drink water. No drinking, no anything like that. You just want to move better. Okie doke. Have a great day, guys. I will see you guys later. I will see you guys on Wednesday night. And if not,